All right, so last week we talked about what makes up the teeth, and we talked a little bit about the tissues around them, but not everything. So today's lecture is on.
Are you giving a thorough test?
I will, but I'll do that right before lunch so we can go over them. So tissues that surround the teeth. Again, the tissues that surround the teeth, you've got gums, you've got bone, you've got ligament, all kinds of tissues that are holding the teeth in their place. So the tissues in general are called periodontium. Okay, that's on the test. Period, and it'll probably come up right now, the definition. But periodontium is a group of tissues. Okay, so not just one, not just the gum, not just the bone, not just the ligament. The whole group is called the periodontium. Okay, so all these tissues here, the gums, the cementum, the periodontal ligament, alveolar bone, okay, all that is called the periodontium. Elective tissues that surround and support teeth. That's the answer. That's what you put on Quizlets. Periodontium, elective tissue that surrounds and supports teeth. Okay? Okay. In the alveolar process, in the periodontium, you have the alveolar process. Alveo means bone. Alveolar is bone process. So the supporting sockets of the teeth, okay, where the teeth are actually in. Okay, that's part of the periodontium. In the alveolar process, okay, there's a plate. The outermost part of the bone is called the cortical, which is a real dense, real tough piece of bone. The alveolar process is made up of compact bone. The cortical plate provides strength for supporting the bone, and acts as an attachment for muscle. Okay, so this hard bone, this cortical plate, again, is helpful because that's where things attach, gives it strength, but it also allows muscles and ligaments and tendons and everything to attach to it. I'll show you a picture right now. So, periosteum covers the cortical plate. So again, the cortical plate is the outside part of the bone. And then you have the periosteum, which is like a fibrous sheath. Okay, so if the table is the alveolar bone, then you have the cortical plate, which is this hard surface. Okay, and then on top of that hard surface, you have a sheath of fiber, which would be the tablecloth. Okay, when we're doing surgery and we have to get down to the bone, we use like a small little pig, or it's called an elevator, but you go down, you hit bone, and then you just scrub up against the bone and you peel back this fibrous sheath. Okay, so if this was the bone, I go down, hit it, and I just lift up this sheath, okay, till I'm down on bone and you can see the bone. And that's what periosteum is. This is what hurts a lot when you have gum surgery. When you peel away this periosteum from the bone, there's a lot of nerve endings and fibers that are on there. And that's why you have a lot of pain on gum surgery, because we're peeling this away from the bone. Okay? We don't always have to peel it back, but again, periosteum is another part of the periosteum. Okay? Lamina dura. Again, this is also a cortical plate that is on the outermost part of the bone. So again, here's the bone. This kind of honeycomb material. Okay, then on the outside, the alveolar process is where the tooth is actually in. So the socket, basically, when you take the tooth out, then you have this socket, and that's the alveolar process. Okay, the lamina dura again is the outside line of it, the kind of the dense, this thick area right here. And and then on the outside is where you're going to have the cortical plate. Here, way on the outside part. Okay, the ligament. Now this is a collection of fibers which the primary purpose is to suspend the tooth within the socket or the alveolar process, okay? So this is suspends, again, they're kind of floating in the socket so you don't have the root hitting down on bone. They're like little shock absorbers that are kind of ligaments that are attaching so that when you chew, the tooth actually gives a little bit. Okay, and if you tap on the tooth like we talked about last time, the tooth actually does move, and we rate it from 1 all the way up to 4. 1 is just a little movement that you can see when you tap, to 4, where it says advanced gum disease, and the patient will sneeze and the tooth comes out. So that would be a 4. If you just see slight movement, then that's a 1. A little bit more, 2, 3, and then 4 is like going back, kind of like our thing out there that blew away over the weekend. Okay, so know the difference between periodontium and periodontal ligament, okay, because those are similar. They're both tissues. The periodontium is the collection of tissues that support the teeth. The periodontal ligament is a collection of fibers that kind of suspend the teeth in the socket. Okay, because you guys will get that confused. Okay, again, you've got, this is here's the bone, the alveolar bone. These little fibers that are going from the cementum to the alveolar bone, or the cortical plate over here, these little fibers that go, this is the periodontal ligament, okay? And the ligament goes up and around, and there's fibers that go up to kind of give strength to the gum tissue and allow it to stay firm. And there's some fibers that come and they wrap around. I'll show you another picture right now. There's some fibers that are actually going through and around the tooth. That picture doesn't show it. Okay. Now Sharpie's fibers are basically the periodontal ligament fibers. It's a collection of them. Kind of think of my arm as the main fiber. And here's the cortical, or the cementum, or the cortical plate, and I'm attaching to it. So a collection of fibers that are just kind of going into the tooth, and that's how it grabs on, okay? So it's just the anchors. So the other end is embedded in the bone. Again, they withstand the stresses of a fully functional erupted tooth. Again, it's kind of like a shock absorber. Again, slight movement is permitted, and this is what the ligament looks like, kind of blown up. Here's the tooth, here's the ligament, and on the X-ray I'll show you what it looks like. It just looks like a dark space. But here's the ligament going all the way around. This blow up is this square right here. Again, you've got a collection of fibers going on, and then when they kind of group together and they kind of grab onto the cementum or the bone, you have, these are the Sharpie's fibers right here, where they kind of go in and grab on. Sharpie's fibers aren't that important, but the ligament is. Okay. Okay, principal fibers, again, that's the main fiber. The principal fiber is the main fiber going from one side to the other. Okay, so you have a whole bunch of principal fibers. This is what I was saying. You've got these horizontal fibers going here. These are, again, at the apex of the root, called apical fibers. You have some fibers at an angle called oblique fibers, and that's not really important. But just know that there's different fibers. And then these little dots here, those are the ones that are going, they're going around the tooth. Okay, they're going this way, circumferential fibers. And all those fibers, they support the tooth, and they're also giving the gum tissue some structure, some strength. Okay, so just know that the periodontal ligament, you don't need to know the difference in the fibers or horizontal or anything like that. Different types of cells in the PDL. Again, in the dentin, and some of you guys got this wrong, what's in the dentin? Odontoblasts. Odontoblasts make dentin.
I was like, I know that's it. I was so right.
I got that one right.
Okay, cementum, you've got cementoblasts, because they make cementum. Okay, different types of functional cells found in the periodontal ligament. So you have cementoblasts. Osteo means bone. Okay, you guys have heard osteo. Yeah, I mean, osteo is just yeah, it means bone. And cement, anything that's a blast means it's making something. If it's a clast, there's osteoclasts. You don't have to know them, but clasts destroy it. So when you have braces and you move a tooth, on one side or on the back side you're making bone. As the tooth moves over, back here you're making bone, so you have odontoblasts. And on the front, as you're moving the tooth, you're resorbing bone, so you have osteoclasts kind of eating away on the... Then you have fibroblasts. Again, they're making fibrous tissue. That's not important. Again, that's kind of what the cells look like. Here's the dentin, cementum. And here's the periodontal ligament and all its cells. And then you have the cortical bone on this side. Okay, gingiva is also known as gums. Patients will come in and they say, I've got a gum infection, but the correct term is gingiva. Okay. So now we're going on to what the gum looks like, so what the gingiva looks like. Okay, there is free gingiva. Not that it's free, it's just free, it's movable. Okay, so it moves. And this free gingiva is just above. Anybody remember what CEJ means? Yeah, bonus points. Cemento enamel, so where the cementum enamel, where they join, the CEJ, the cemento enamel junction. So just above the CEJ of the tooth. Above meaning, or below, if it's a lower tooth. Okay, so here would be the CEJ. Again, and the free gingiva is, this area right here. This tissue right here. And that's the area that we probe when we poke around the 6 areas of the tooth. Okay, so we put a perioprobe in there, and we probe a 2 or a 3 or a 1 or whatever it is. So that's the free gingiva, because it's not attached to the tooth, it's free moving. Okay, question on that? So it's kind of hard to see on these pictures, but you can kind of see the little roll right here. So right around here is the free gingiva, this area right here. And you can, it's kind of right here where the light shines, then you have, it changes from here to here. This is where it begins to be attached gum tissue up this way. Okay, so right around this area right here. You can kind of see how it rolls. And you can probably feel yours or see yours when you look in the mirror. Okay, so know what the free gingiva is. Know what the gingiva crest is. That should be gingival crest, or gingiva. And that's the peak, the crest of a mountain, or the crest of a ridge, the crest of something is the tip, the highest point. Okay, so the gingival crest is the peak of the free gingiva, right here. Okay, so you've got free gingiva, that's the crest right there, the highest point. All this is unattached free gingiva. It's not right here, it's up here, the highest. Okay? Or if you're looking here, I mean, that could be the crest right there. The highest point of the free gingiva, depending on where you're looking at it. Okay, so in here, the sulcus, again, we talked about, is the free gingiva. So that's the space that exists between the tooth and the free gingiva. That's what we measure, the sulcus, or the pocket. I didn't give you the study guide.
I was gonna ask afterwards.
gingival sulcus is the space that exists between the tooth and the free gingiva. Again, that's what we measure, this little pocket right here. Okay, interdental. If you break that word up, what do you think it means? Interdental. Papilla just means gum, basically. Interdental. Break that word up. Interdental. So between teeth. Interdental. So between teeth. So gum tissue between teeth, basically. Interdental papilla. So it's a triangular shaped crests of gingival tissue located between the teeth. These crests of tissue consist of free and attached gingiva. Okay, so again, you're going from between the teeth. So this triangular tissue right here, the whole tissue, okay, this triangle is intradental papilla. Anything that's between the tooth from here and here, so this triangle here, and then what goes from one side to the other side, all that is intradental papilla. Okay. So this triangle here, anything, if I were to cut this from here to here to here, this is between the teeth, intradental, and it goes from here and comes down on the back side of the tooth. All that is interdental papilla. Okay, attached gingiva is a portion of the mucous membrane bound to the tooth and to the alveolar arches of the jaw. Okay, so attached gingiva is going to be from here down to here. And that's the really pink tissue. Okay, so right underneath the free gingiva is where, you know, you have the periosteum that's stuck to the bone. From here down to here is attached gingiva. And if you look at your gums, okay, right here or right here, okay, you can see how it changes color to a more or darker red, okay? So from right here to here, you have attached gum tissue. And then you have unattached gum tissue, which is up here. Yeah, that's your frenum there. It's kind of hard to see on this picture. But anyway, you can see how this is nice pink, really tough, keratinized tissue. Free gingival groove, again, is right below the free gingiva. It's just a little dip, a little groove that you can see right underneath the free gingiva and where the attached gingiva starts. So again, that roll, that light that you see, okay, this is the free gingival groove. Okay, and if you look at it sideways, right there, that little dip. Okay, so right underneath the free gingiva, you'll have what's called the free gingival groove. Okay? You go print that real quick.
Did you put water?
I need the dimensional object.
I
Like,
did. Oh, it was for
and it kind of makes you pulled over.
Because
And
all of them were
like,
firemen showed up.
this one, not that one.
One of the classes.
Oh my gosh.
That was the plus I could like.
Yeah,
right?
Oh, so
What a morning. Not even good, but it was the cheap museum and cheap.